Hi everyone, Cooper from GridSpace here. What I want to talk to you about now is kind of an extension of a previous video I did about retention of participants in a clinical trial facilitated by our virtual voice agent Grace. If you did not see that video, there will be a link to it in the description for this video. So starting from that same premise, Grace doing proactive outreach to manage relationships with clinical trial participants and make sure that uh, they keep coming to sessions and that any concerns they have about the trial get addressed. I've given Grace the extra ability this time to manage the high urgency, hopefully rare situation where someone expresses their wish to drop out of the trial. And I've done that by adding some special pages to the playbook that we used before. You can see here I have a page called Dropout Risk. And on this page, what we have are some shortcut triggers. These are phrases that amount to the same meaning that train Grace to hop over to this dropout risk page if she hears people express this meaning at any point during the main conversation. Basically, Grace will stop what she's doing, progressing through this playbook, and hop over to these special pages to handle the situation that may not normally come up in the usual course of the conversation, but needs to be handled very seriously and very suddenly if and when it does come up. So we look at the other pages in the playbook. We'll see that the shortcut triggers that we had on the other page are active on every page in the playbook. Basically, this checkbox here indicates that on this page, Grace is listening for someone saying that they want to drop out of the trial, and she'll take action if she hears that. If for some reason we don't want to be able to jump off of a particular page, normally that's when Grace has like a disclosure that she needs to read in its entirety and verbatim. We might want to disable the shortcut on just that page, but generally we're going to leave our shortcut triggers active on every page of the playbook because shortcuts are really good for these high urgency situations that don't come up in a typical conversation, but need to be managed very seriously when they do. So that's how shortcuts work, and that's how they can be used to manage high-risk circumstances, like a clinical trial participant wanting to drop out of the trial. So I'll do another little demo where I play the role of a clinical trial participant, and Grace has called me. But this time I have a serious concern, and I'm going to tell Grace that I plan to drop out of this trial. And we'll watch her spring into action to deal with that.
Hi, this is Grace with the Harper Hospital Clinical Trial. I'm a virtual clinician assistant, and I'm calling to check in and see how you've been doing. Do you have a minute or to the top right now?
Grace, I'm actually really glad you called. I want to stop participating in this trial.
Okay, I understand that you're feeling like you might need to end your participation in the trial. We take the concerns, needs, and help of our participants very seriously. Could tell me a little about why you're feeling this way?
I've felt physically exhausted for up to 48 hours after every session that I've participated in.
I'm going to transfer your call to an administrator who can help you get to positive resolution. One moment, please.
Okay, so that was Grace listening, going through business, just asking me a normal set of questions. But then when I express that I want to drop out of the trial or that I have some serious concern which may affect my participation, Grace drops what she was normally doing and hops over to this page, Dropout Risk, where she runs through a little subtask to collect information about why I think I need to drop out, and then passing along the call to a designated human being who has the skills and the knowledge to counsel participants and do whatever they can to make sure that no one needs to drop out of the trial. So Grace is great for retaining and managing relationships with clinical trial participants. And we can also give her these shortcut superpowers where she can do high urgency tasks that fall outside of normal bounds and make sure no one has to drop out of the trial. All right, cool. Until next time.